Well, good afternoon, everyone, and welcome to the Community Transformation webinar for December, your pre-Christmas look at all things community transformation. The focus this month is on neighbourhood mental health teams and a model really for Sussex and also our current roadmap. I'm Simon Fielding. I'm from the Trust's communications team and one of those on the Community Transformation project. I'm delighted to be joined by our guests today, Karen, Oliver and Martin. We'll come onto their introductions in just a moment. But just a bit of housekeeping first of all. The webinar today is being recorded and is going to be added to the Community Mental Health Transformation webinar playlist that we've got on YouTube. If you prefer, please keep your camera turned off and you can anonymise your name as well. You can turn on live captions today by clicking the three dots on the bottom right-hand corner of your screen, and there's going to be 15 minutes for question and answers at the end of the session. You can submit your questions into the Q&A box or raise a hand after the presentation and we'll get to you from there. A summary of the topics covered in the webinar will also be emailed to participants at the end, and we do ask you as well just to complete a short survey email to let us know what you think of the webinar and of course how we can make it better. So all previous webinars that we've done so far on community transformation can be watched back by scanning this QR code. So I'll leave that up for just a moment in case you want to have a look at that now, or indeed just take a photo of that, save that for a little bit later on. So our panellists for today, our presenters, we've got Oliver Dale, who's Clinical Director for Community Mental Health Transformation, Karen Page, who is VCSE Mental Health Transformation, part of the team in West Sussex, and Martin Dominy as well, a VCSE Mental Health Transformation in East Sussex and Brighton and Hove. So good afternoon to the three of you. Welcome and thank you for joining us today as well.
Yeah.
Going to go into a little bit of context setting really and background. So Oliver, we'll start with yourself, I think.
So some of you will have heard this before, but the reason why we're all here is that in 2019 the NHS long-term plan was started, and in particular the community mental health framework was tabled as the preferred model of community services. That framework was developed by an organisation called the National Collaborating Centre for Mental Health. And it argued that in order to improve the care for people in our communities, we needed to bring together our primary and secondary care mental health services and form a partnership with colleagues in the voluntary sector as well, and also primary care. NHS England developed a set of criteria through which we have to apply in order to meet the requirements. And what we're going to share with you today is where we've got to in terms of the model, the service redesign that we think will meet those requirements. Could you go on to the next slide, please, Simon? Thank you. So basically, there are a couple of key innovations that the framework is asking us to consider. And the way we've conceptualized this is by creating a public health model to mental health difficulties, so that we are more geared up to offering help earlier on in people's journey, so that we meet needs before they escalate into crisis. And in particular, this means moving away from the idea of primary and secondary care, so that there won't be such a distinction. And this was the primary and secondary care model is quite a long-standing model, sort of developed really in the 1980s. And the issue with it is it's now sort of probably out of date. What we're trying to create is a service that is much more able to anticipate people's needs and prevent escalation. So a common concern that people describe is that before they get the help they need, they have to be really unwell, And so sometimes offering people help at that stage actually is counterproductive, not only to them, but also to all the people that are trying to help them, their families and GPs and ourselves. And in order to do that, one of the things we also need to do is create services which are much more able to work longitudinally with people and provide a range of different social and occupational interventions that are meaningful to them. But then sometimes at the same time, we may need to offer much more intensive and specialist help. So it's about getting this balance between the mainstream services and specialist services as well. But generally speaking, being a much more responsive and having a more open door for people. Do you want to move on to the next slide, please, Simon? So I'm going to hand over now because to Karen, who's going to take us through the next slides.
Thanks, Oliver, for that introduction. Yes, so I'm going to talk a bit about what we're trying to achieve in Sussex and then also some of the progress so far. So see, these are some of the key principles that we've been working to for the last couple of years. So really importantly, to have more support available for people with serious and or complex mental health needs, but that to be available around PCNs, so those clusters of so primary care networks, those clusters of GP practices at a local level. It's really important that services are coming and working together to plan, deliver and monitor care. So looking at how we can all work together more closely as part of a system to give a more kind of coherent and clearer access to a kind of a range of services at neighbourhoods. So some of those might be new services that haven't been available before, but a lot of them are already there. It's about kind of increasing the connectivity, but also raising awareness and kind of smoothing out some of those pathways. As we're working together at place in a much more joined up way, it's also really important that we're clearly and consistently processing and recording outcomes so we can support people in the right way, but also really evidence the way that we're working and kind of look at sort of what's working by place, what the need is, and how we can all work together more effectively. So as that second to last bullet point says, it's about locally based teams, but with a much broader range of skills and an ability to work more closely with partners. And Oliver's talked about the role the Sussex Partnership has already, but also that broader voluntary sector role and the different parts of the system bringing, harnessing the different strengths that we all bring. And finally, on this slide, just ensuring that there's really specific helps for people who need it. So that's for adults and older adults to have an age-inclusive age-inclusive offer, but also around some of the more complex needs, eating disorders, and so on. Could you move on, please, Simon? So the community transformation is really, it's about integration and partnership approaches rather than investments. As I said, I guess it challenges us to think differently and work together differently and more effectively to best support people's needs. So we'll be looking through kind of integrating more to be more efficient and more joined up, and have that kind of shared care approach. And that's something that we've made huge strides on over the last last few years and longer, but it's about really taking that to the next level to really give the best possible care for people in their local communities. So, and then Oliver's really touched on some of this already, but it's about balancing some of that evidence-based medicine and some of those kind of more clinical approaches with that wider kind of social, occupational skills and activities and services that we know really make a difference to people when they're struggling with their mental health, and actually sometimes can be the causes or triggers for those. So we really want to make the best use of the skills and resources that we have as a community and develop and a kind of a really close partnership model. So if you could move on, Simon, so our agreed principles of care, these are really important, and Martin will come on a bit later to talk about how the model's been co-produced in a bit more detail. But through a number of workshops and events, these 4 principles were developed that have really kind of guided us in taking our work forward. So having personalised and complete care for every person in the system. Really important that it's simple and seamless so people know how to access support, what that journey looks like for them, and they're not having to jump between different services in a really disjointed disjointed way, that we're coming together to give the best possible support for people, that it's accessible and inclusive. So we're looking at, you know, who can't currently access support, what barriers can we break down so everyone gets the support they need when they need it, and that we're one team working together across the statutory sector, the voluntary sector, a range of different organisations to give the best possible care. Thank you, Simon. So our progress so far, so if you could skip on this map, just gives you a bit of a journey, and you'll see this mirrored later in some of where we're expecting to go. So I wanted to pick out some of the key highlights from that, but I won't go through every different point. So you can see at the start in 2021, we were coming together as a group of different organisations, forming kind of governance structures and meetings to really work together, you know, across Sussex Partnership, the voluntary sector, NHS, local authority, primary care, and really importantly, with the voice of lived experience to talk about what this looks like and how we want to mobilise in West Sussex. So across Sussex, a really big development was the emotional wellbeing service, and that started to roll out across Sussex in 2022, really building on some of the good practice that was already around bringing voluntary sector and Sussex Partnership staff into GP practices to make services much more inclusive and start to join up some of those systems and bring support to people where they really needed it. As you can see, after that, there were a number of initiatives started to really strengthen the role of the voluntary sector in the transformation, and Martin and I and many of our colleagues are there sort of supporting that. As a result of some of that investment. Steering groups have been set up for some of the specialist partnerships, and a lot of work's been happening over that time to really start to look at what that looks like in our newly transformed system going forward. And then there was some additional investment to the VCSE for mental health inequalities, which has had a really big impact in some places. That goes on to talk about some of the workshops that we held with people across the system, really importantly hearing the voice of lived experience, and from families and carers, and hopefully some of you on the call were able to join those. And 2 community rehab units were opened in West Sussex. And then starting to move on from that later in the year, having place-based workshops to really think about with representatives across the system to really think about discussions and plans, and that led to some of the work that Martin will be presenting shortly. Just skipping on ahead, I'm sure you can see the slides, but obviously we've got the clinical director appointed for the mental health transformation programme, and really great to have Oliver here guiding us through that process, and the community mental health transformation programme team being formed, and that's a group of individuals from across different systems, from Sussex Partnership, from the voluntary sectors, from some of our broader partners, who are really coming together and planning what this work looks like and providing the leadership across Sussex. There's been some work around changing the language, which is really important in terms of how we communicate, how we can make services accessible, and what things mean. And then I guess really excitingly, as you can see in bold, 30 out of the 39 primary care networks across Sussex have now got the emotional wellbeing service launched, which is the real foundation and the kind of cornerstone for some of the principles we're trying to achieve through the mental health transformation, and has really opened up additional support to people who really need it. And now, I guess, you know, part of it is about how we've been working together to really operationalise that and understand the different roles that we all have, and really and drafting that integrated model, which I won't steal Martin's thunder. I will let him talk about that in a minute. But then having a system-wide group to progress the multi-agency triage and develop a consistent approach across the 3 areas, and then moving into some of that we had the consultation about what that integrated model looks like. I'm really pleased to be able to share that with you now, and I'm going to hand over to you, I think, Martin, if that's okay.
Just take myself on mute. Thanks, Karen and Oliver. Some real kind of important kind of journeys. We've kind of already taken on some of this, and some real good achievements, particularly around that PCN development, which has been really challenging at times. But like I say, it's a really important kind of change around cultural development in terms of us working together much more closely. So it's been mentioned a few times as well, but I think we have really approached this and making sure that we are really kind of trying to work differently in terms of much more of an integrated kind of way, but also much more collaboratively with all parts of the system as well. And hopefully you've kind of got a flavour of that as well. So we have kind of really kind of invested a lot of time and energy around making sure that people are consulted. And again, this is all, even today, as a part of that consultation, it's taking kind of questions, taking feedback, kind of really kind of responding to some of the challenges that we know that are already out there as well. So we've extensively worked over the last 3 years with kind of many different groups, people with lived experience, families and carers, and colleagues across the system as well, to make sure that we do hear all voices, and then we can kind of bring everybody's expertise and experience into these conversations as well. And then we have kind of worked hard on a number of different kind of formats, and again, webinars is one of them, to making sure that we can gather voices from all parts of the system, but also kind of voices that we don't always kind of hear as well. One of our challenges is actually how we're going to describe this new way of working as well. So we know people really kind of appreciate having visual representation of what we're talking about. So we have kind of really kind of worked to kind of draft a kind of model diagram to help us to kind of explain that. I think we've recognized actually kind of having one diagram to kind of explain a whole complex mental health system is a bit of an ask. So what we've kind of done, we've kind of got a kind of a model that many of you might have already seen, but then we will kind of be building on that, be supporting that with kind of documents around kind of framework documents, but also kind of short animation films to be able to visually sort of see that and how these systems work together, because it is, again, quite hard to see one picture and for it to explain all that as well. And again, we've kind of really taken that out for a consultation. And I think we've really noticed, because actually we're working much more closely in the system, some of the numbers we're getting in terms of the feedback for kind of consultation or questionnaires is so much higher than we've ever been able to achieve before. So it's not uncommon for us to send out a survey and get 300 responses now. So it is really kind of changing and really improving the way we're communicating with each other as well. So next slide, Simon. So again, there's the final model diagram that's still with the designer. So hopefully we're kind of only a week or so away to actually having that as well. I think we just wanted to have something where it's quite clear in terms of what we're trying to kind of achieve. So we kind of based it very much on the Thrive model that people might have kind of really heard of as well, to kind of offer that uniformalities with other things that might be going on in the system, other kind of specialist kind of pathways, for instance. So it's around kind of getting advice, information and guidance, getting help, getting more help, and really kind of making it quite easy and clear. What this diagram doesn't kind of really demonstrate very clear at the moment is actually we really want to kind of have a service that people can kind of use it much more kind of fluidly. They can come in, they could be kind of receiving some high level treatment particularly, but they could also get some advice around housing support at exactly the same time as well. But again, that's what the animation will be kind of doing as well. So it's really kind of taking some of the kind of principles that Kieran kind of spoke to about there, to actually saying that we were working as one team, to kind of really trying to personalize that kind of tailored option for people around their support and needs as well. So again, we'll be sharing kind of this in more depth, and then every ring where we're going into kind of more depth about what that looks like, how people use those services. But some of those key things we want to make it much easier and clearer about people, about where do they go for information about services, where they can get some health self-help information, how can they access more easily, how they can come in and out of services as well, and what's really kind of available as well. But also we kind of recognize that this is the community mental health offer that we're talking about here, but it's also really integrated with urgent and crisis younger people's services as well. So there has to be real kind of alignment with all these other transformation programs that are happening across Sussex as well. So it's been a really good bit of work, and this working group has always been kind of represented from all parts of the system as well, and it's been a really kind of positive outcome as well for everybody. But again, there's more documentation around kind of what does it mean in detail, what practical kind of steps do we need to do to achieve these neighbourhood teams as well. Thanks, Simon. So this is some of the people that I mentioned earlier about some of the people we've met, some of the webinars that we've got, some of the feedback we've got as well, and some of the kind of our work that we've done across the kind of the webinars in the past as well. So again, it's absorbing all that feedback, and hopefully there's some more feedback and questions today, and taking that into kind of the way we're kind of taking things forward in what we're now calling our phase 2, kind of our real proactive step forward in terms of how we are going to go about integrating services as well. Thanks, Simon. Oh, just jumping ahead of myself to my next steps, but yeah. So the integrated working group, I mentioned we were kind of making that final adjustments as now, and then we'll be sharing that in 2024 as well, and hopefully that will be coming out to other webinars, and you'll have chance to kind of comment again, kind of going forward into the new year. So am I handing over to Oliver? Yep, thanks, Oliver.
That's to me. Thank you, Martin. So it's, I guess, a bit confusing in a way, because so there's the model which we've just described, which is effectively a conceptual basis for service redesign that is working in all sorts of our community teams, and including the specialists and the more mainstream ones. And then there's the model of the actual service itself and the team itself, and what teams themselves and what they're going to look like. So what we're going to talk about in the next couple of slides is the core team that is going to effectively be the linchpin of the local neighbourhood. And so the way we're talking about is there's the core team, and then sitting around that is the neighbourhood. So at the moment, we've in Sussex Partnership Trust, we've got 2 particular teams which are, well, and 3 really, which are particularly relevant. One is the Assessment and Treatment Service, the ATSs, and then the other one is the Emotional Wellbeing Service, and then also in the mix is a trust-wide service called the Access Facilitators, and what we're proposing is that we bring these teams together into one core team, working together, and that they would be probably at this stage at least in the current footprints of the ATSs. So I work part-time in the ATS in Littlehampton, and so that team would still be there, but it would be joined with the Emotional Wellbeing Service and the Access Facilitator into this new Neighbourhood Mental Health Team. And in our local patch of Arran, Ada and Worthing, we would still continue to have a team in Worthing and another one in Shoreham as well, and something similar would happen there. So this core team would be then developing relationships with other local services. So in particular, our GPs and IAPT, but there will be all sorts of other services as well, like CGL and so on. And so within the core team, the voluntary sector partners would be a key component of that. And they too would be having links to our local neighbourhoods, and people would access that through social prescribing, amongst many other things. So the neighbourhood team would be effectively working towards this partnership approach. It would be interested in acting earlier and being able to anticipate needs in order to address local health inequalities and prevent escalation. And it would work much more closely with people's GPs. So you wouldn't have to have lots of different referrals. You'd only have to have one referral into the team, and we'd be able to work out amongst ourselves whether IAPT or Thinking Well or CGL would be most appropriate to be working with the individual. So we'd have this multi-agency working where we do triage and consultations and interventions together as a shared basis, so that people aren't having to tell their story repeatedly, and that we're able to hold them in mind, and also provide them a more holistic response to their needs. So thinking about social support, occupational activities, hobbies, housing, debt, employment, and so on. We go on to the next slide. I just noticed that Mel's put her hand up, and I don't know if Mel, you want to come in now, or I'm not sure. carry on.
No, sorry, very quickly, I unmuted. What you're talking about, and you have spoken about, each of you since the very beginning, is exactly something that's being discussed by people participation team with great strength. And you do have a pool of people ready and willing. The EBEs are very stringently looking at this kind of thing, and you would have a field of people going, yes, they wish to know how strongly their work is being received and if it's any good. And a gesture from you saying, apply if you wish, would be a sheer reflection. So we'd keep them interested, and you'd actually have the help on hand that you need, require, and they are a good bunch in there.
Yeah. So one of the, I'm glad you mentioned that, Mel. So one of the developments we want to see is the availability of peer support across the board. So at the moment, peer support interventions are a bit piecemeal. There are some areas where it's fairly reliably on offer, and sometimes you have members of staff who are permanent members of staff, but sometimes they're on bank, and sometimes and some services don't even have any at all, I'm afraid to say. So that's one thing that we're trying to do. But that, I mean, I've just seen in the chats that EBEs are not peer workers. That is quite agree with that. And there may well be other things that we want to do within some of the specialist pathways, for instance. So in the complex emotional needs pathway, I know in other organisations, lived experience practitioners have co-facilitate emotional regulation groups, for instance. So these sorts of opportunities we do hope to see develop. With the core team, there are a couple of other sort of areas we're looking into. So we're thinking also about identifying dedicated support workers for 18 to 25-year-olds and also older adults, because they have particular needs and that are a bit more may require a bit more of a bespoke approach. Some of those plans are in the early stages, but that's certainly on our minds going forward. I'm not going to say any more, I think, about this particular slide. I'm just wondering if we can move on and hand over. I can't remember. Oh, it's the roadmap. That's right. So if we can move on to the next slide, please. So this roadmap's sort of a little bit out of date, and we sort of working on it in the summer, really. But it's broadly speaking, it describes how we're in the middle of sort of phase 2. So some things we're a bit ahead of, and some things we're a bit behind in, but more or less we're in what we're calling the phase 2. And that's where we're going out at the moment, and we're talking to lots of colleagues and different services, principally the ATSs and the emotional wellbeing services, but also other services as well. And we're just trying to shape the plans to be quite specific about what we mean and what we need to do and when we need to do it by. So let me just tell you, some of the conversations we're having at the moment are, what would a new service actually look like on the ground for a member of staff working in it? And what would that mean for someone that was referred to into our services? So one of the big questions that we have at the moment, which is how do we manage referrals? So at the moment we have separate teams which stand alone, and they triage referrals across quite a large patch. It's actually, although from an operational point of view, you can give quite a consistent response. From being able to respond in a patient-centered way is actually much more difficult, because quite a lot of our patients are referred back to us. So we know quite a few people, and quite often they're already established relationships within the service. So being able to keep that story so that we can provide not only someone who may already know the person, but also some knowledge about what worked before, what didn't work, and so on, can be really helpful in providing much more patient-centered care. So we're looking at how do we move triage back into the teams, and how do we work more closely together across these different services. So that means that the teams will need to have different meetings. And so there's one meeting we're calling at the moment a daily huddle, where referrals come in and we're able to think about them. And that might include different these different services that we're just talking about. And another meeting we're talking about with colleagues is something called a neighbourhood meeting, where the GP and the team might be able to think about some of their shared patients. And so these are the sorts of details that we're needing to work out, and how our colleagues within SPFT, within our VCSE and also GPs, how they might work differently. And we're having to work that detail out at the moment. And what we hope is that by early next year, we will have agreed that detail, and we will then be able to describe a lot more clearly about when these things will start to happen. And we anticipate that by the end of next financial year, so March 2025, we will have got these teams up and running, and all the different structures and systems they need behind them to make them work safely. So the moment we're we know where we want to get to. It's now working out who's going to do what, why are we doing this particular thing, and when are we going to do it. So that's the current place. I don't know, Karen and Martin, what you think. If there's other things to add to that, though.
No, I suppose it's just kind of acknowledging sometimes it's very complex. And even though I think we kind of really want to kind of, improve and transform services as we can, sometimes things do take a long time, or there are other kind of initiatives that come in that kind of we do need to consider. There's a lot of talk around kind of footprints around how kind of areas are going to be divided up at the moment as well. So it's just acknowledging some other conversations and other pressures that we have, but making sure that they never kind of paralyze us, that we always keep going, and we always kind of do kind of trying to work through things as quickly as possible, really, as well.
Absolutely. Yeah, and the only that all makes good sense. And the only other bit I would add, I guess, is it's about, I suppose we're at the stage now of really giving areas the permission, but the structure and the guidance to get on with mobilizing this. And I think that's really crucial. And that, I guess, that's what we're talking about in terms of stage 3, is how those different places can then really run with this, so people can start to experience something very different. And that's, as Martin and Oliver said, that's quite complicated, but it's also the really exciting bit as well, because that's when we'll really start to see that system change.
Yeah, and I think that's going back to Mel's point. I think that is also kind of really opportunities for local EBEs to be kind of part of that kind of local transformation of services as well. Because we've done things in terms of the scale group often around consultation, but I think now we can actually kind of really kind of get into that local place-based option and offer as well.
So I think we've done with the slides now, Simon. If I remember correctly, yeah.
So thank you for everybody that's contributed to that discussion. Really, really insightful and knowledgeable about the work that is going on. Some great work as well. Let's open the floor to any questions. So you can either raise a hand, as Mel did earlier on, or put a question in the Q&A box, which should be at the bottom of your screen. Mel raised a point earlier on, actually, about referencing working together groups as well. Mel, I don't know if you wanted to come in and just ask that question, or if there was it was
literally that question, because you could really progress things. You have such keen people in there who they actually very much support the staff as well. They're not just letting the staff go, and what we do is, and it's really working together. It really is, truly. And by coming forwards, we've had the ITS come forwards and introduce themselves a while ago, and they really are impressed by that. They're so impressed when someone comes along and you could really, really get the assistance you need. They wouldn't, and this has been good in chat, they wouldn't do peer support as well, because they know they can't conglomerate the two effectively. They really do understand what they're talking about. And if ever possible, I'll stick my email address in the box, and then just let me say to them, I can put forward, well, I have mentioned you to a couple of people, just so they know that voices have gone forward.
Yeah, and the offer's there for us to kind of join any meetings that you think are kind of appropriate as well, Mel.
I would contact people participation team.
Yeah.
And contact them and say, right, well, we've been speaking to Mel, So because I attend their meetings regularly, that's how I see my constituents.
Mhm.
And the beautiful part, tell Mel, she'll open her mouth, you know it. And so they'll see I've opened my mouth again, and it's to this benefit. This is something they speak very strongly about, and actually something that you'll like, down to colour and font, that will appeal to someone and make them soften it and read it. And you've got exactly the colours and fonts they talk about. You can say, yeah, look what we did without anyone talking. They'll really be impressed by the communication.
Oh, thank you, Mel. Oliver.
Yeah, I was just going to add, so we do have links with the participation team, but just to say, Mel, we might not have got it right on the different meetings that we come to. So Penny, who can't be here today, and I are doing a bit of a roadshow at the moment, and we literally, our diaries are packed, filled with different meetings and people we're going to talk to. So if there's a particular meeting that you think we should come and talk about the new model, then please do let us know.
Do you mind if I just ask them and say, right, there could be something that I can show you? Or invite someone along to, and then because they're either Mondays and Tuesdays or Thursdays and Wednesdays, you're fine. But I've stopped my email address in there. If you drop me an email and we can figure it all out, and I can get the introductions to the right people.
Yeah. So what I'll drop you a line, and we can. Yeah, as I said, we're happy to come out and meet people and go through what we're up to and have conversations about.
The marvelous thing that you like about this is actually, and keeping it online is actually getting a much stronger response from WTG, because they're completely able to say what they want. They can blank their faces out, and you're getting such stronger response as a result, that actually keeping things online for this kind of thing as well would actually be very helpful for you. You get a stronger response because people can be anonymous.
Erin, did you want to come in there?
No, I was just going to say, I mean, really helpful. Thank you, Mel, for that. And just to say, we are trying to consult as widely as possible. I know, so we're, outside some of the, the Sussex partnership structures, we're talking in Pathfinder in West Sussex, to people using services. I know that's happening in Brighton and East Sussex as well. Andrea, one of Martin's colleagues, went and spoke to mental health carers. I believe that was in East Sussex. And actually Penny and I have got a meeting in January in partnership with Carer Support West Sussex for mental health carers in the evening online. So we're really, really interested to hear what's out there and what those different opportunities are. I'm really committed to keep talking as the process evolves. So thank you.
And thank you for the raise.
Can I just add another thing to that as well? Because quite often when change programs go wrong is if they just say, here's the model, we're going to do this, and we're starting on Thursday. And what's good about the work we're doing here is that we're talking about starting quite a long way away. So the plans are being made as we speak, and each meeting we go to, the slide deck will change following today's meeting, and so the plans are evolving. So it's really important we do come out to meet people. So yeah.
A question here. Is there any extra work being done around resolving staff shortages, specifically filling frontline posts in order to balance the supply demand for mental health services? And this is to ensure that any of these plans are deliverable.
So it's a really, really interesting question about staff shortages. So people may know I came from a different area, and we had staff shortages there. So staff shortages is a national problem. I do think there are some particular issues locally, and one of the reasons why the ATS teams in particular find it difficult to recruit is because quite often they lack the therapeutic options that make this work, really enjoyable and rewarding. And so the hope is that if we are able to create a team that is broader and has a richer range of skills and opportunities, then in actual fact, it will become a much more exciting place to work, and much more attractive, and so on. So, I mean, my own view. I mean, I've worked in a transform service, and that was my experience. That by having a lot more colleagues and being much better connected to my GP colleagues and IAPT in particular, it was really rewarding. And I saw that our recruitment got better and better. So there's a thing addressing the problems that people are describing, and therefore stopping people voting with their feet is a key part to our recruitment strategy. The other thing that I think we touched on earlier is the role of lived experience. And I think, as Mel says, there's lots of people out there who want to get involved. And I used to work in a hospital called the Castle Hospital, and years ago, the lead nurse there said that your patients are your greatest resource. And I think, in a way, lived experience practitioners sort of speak to that. So I'm hoping that we will be able to develop opportunities for all sorts of people, some with lived experience, but also perhaps some other professional backgrounds as well. So mental health graduates are a relatively new introduction, and apprenticeships and things like this. So there are a number of different levers that we're pulling on. So I'm feeling quite hopeful. I mean, things aren't good at the moment. I think that is true, but I am feeling quite hopeful. But yeah, so Martin, I don't know.
Yeah, just to really concur what you were saying, really, I think it is around recruitment of new people coming in, and how do we make Sussex an attractive place to work, and that has to kind of go on sometimes around that reputation. How do we really attract people to want to work in Sussex? But as Oliver said, how do we retain those members of staff as well? And it's really exciting to think about new opportunities. So if we know there's like some vacancies in particular roles, then actually maybe the kind of the VCSE could look at them. Maybe people with lived experience, maybe peers could be taking some of those roles as well. So I think we need to kind of look fresh eyes on some of this work as the program kind of works out as well. But I think that was always kind of one of our, if we go back to the principles, I think we really want to kind of endorse the model of one team, so we'll all work really much more closely together. We're much more supportive, we're much more effective and efficient, and hopefully we'll kind of, as mentioned, make these jobs more enjoyable for people as well, and more job satisfaction across the board as well. So we know we've got some work to do, but obviously Oliver mentioned this is a national issue, but it's something that we really kind of want to kind of get our hands into and kind of get on with as the kind of models start to roll out as well. But it's also just thinking about, neighbourhoods, working closer to home. So that's attractive for people. It's attractive for people that are using services, but also attractive for people who are kind of working within services as well. So really feeling like they've got a real good sense of their own community and where they work and the relations that they kind of, the people they work with as well.
The other reflection I have as well, working in a different transformed service, was how I think we all found ourselves working differently and doing new things. And so we introduced a sort of a brief assessment model, which it was really our peer workers and social prescribers that largely did it. And it was just quite invigorating working differently. And I mean, I found myself changing my practice as well, and it was quite exciting. So I think when you work together more collaboratively, you find people tend to innovate and experiment and try things out and become a bit less anxious.
And time just as well for a follow-up question about consultation. So what consultations have taken place with these frontline staff, in ATS, EWS specifically?
Okay, shall I take that first? And then, so the consultations are, the first phase of that is the discussion. So we're going out, so we've only been to 4 of the ATSs and 1 of the emotional wellbeing services so far, but we've got, my diary is, as I said, is getting packed full in January. We've got loads and loads that we're coming to. So the first thing is to talk to the individual teams and to explain exactly what we mean. And as Martin said, this is really complicated. And there are all sorts of what ifs and what abouts and that need to be drilled down. So that's the first thing. The other thing is we will be going to staff side and the local negotiating committee to talk about these plans as well and what they think a consultation process should look like. What we suspect is that sometime next year there will be a formal consultation process. The fact of the matter is, though, is people's working lives won't actually be changing in a hugely dramatic sort of way. I mean, you'll still be seeing people, you'll still be working in a team. Most people will probably still be in the same buildings or having similar, but there will be some quite local and specific variations though, so that needs to be thought about locally, and so on. But so for me, the biggest part of this consultation is about the going out and actually individually, personally talking to every single team, frankly. And as I said, the plans evolve as we're doing that. So the consultations is a bit of a two-way street, really.
Excellent. Oh, Martin, did you want to come in there before we?
Yeah, I think it was just that point of reassurance, really, isn't it? That we're not looking to kind of like reduce the size of the staff teams. We're not looking to kind of change people's jobs as well. And I think we want to be really careful that we don't want people to feel anxious, as Oliver kind of mentioned as well. We know we've got vacancies in the system in some of our services as well. So we don't want people to feel kind of at risk or really kind of worried about their kind of future and incomes as well. So, and that's why Oliver and Penny are doing this, some of this consultation just really slowly, really gently, and just going and having conversations as well. So no decisions to be made about anything. It's a process that we really want to engage really kind of fundamentally with people.
The other thing that was quite funny, it's difficult to sort of describe in a way, that is what I found is that people and services are working individually really well. And what we're talking about isn't sort of changing the teams, as it were, so much and the individuals, but it's actually bringing things together, and so that we work more effectively as a system. And quite often, a lot of the difficulties that people are bringing. So a common thing that people say is that that they find this working in the adult service is difficult because they feel on their own. Well, really, what we're trying to do is to give people the experience of not working on their own. So I'm hoping that actually, from a consultation point of view, we are providing solutions to people's everyday problems.
And sorry to jump in without putting my hand up, but I guess the way that I've been describing it in the voluntary sector to our staff, but to wider colleagues, it's about how we come together and integrate. So it's about, I guess, it's about working differently, I suppose, and working more collaboratively. So it's not necessarily about lots and lots of new things, but it's about drawing together what's already happening and it being the best it can be, and really sort of integrating services. And actually, certainly in West Sussex, and I know there's examples in other parts of Sussex through the Pathfinder model with kind of integrating services between Sussex Partnership and the voluntary sector. We've done a lot of learning and actually thought about the strengths we bring together and how, coming together as a system and a team, we can deliver a better quality of service that's more seamless. Really excited about what that will look like going forward. So I guess for us, it's about taking it to the next level.
Can I just also comment? Someone said that they don't think it's helpful to add to ETS, and we're not talking about adding to ETS, and we're not talking about adding to EWS. We're talking about creating something that is new, different. I think we have a similar view. We don't want to simply just add to ATS.
Great. I think that's covered everything, hasn't it? It was a really insightful hour or so. Thank you to Karen, thank you to Oliver, Martin as well, and to everybody else that's contributed in the discussion as well. The next Community Transformation webinar is going to be on Wednesday, the 17th of January at 12 o'clock. More details going to be released soon about the specific topic for that one. Thank you for watching. Thank you for listening. And hopefully you have a peaceful and relaxing festive period. And we'll see you in 2024. Thank you very much for your time.